Hello, my name is Anna Patricia Torres, and this is my head-to-toe assessment for Maryville University. I'll begin this assessment with a 360-degree turn of my room. Today we have Carlos Torres, who's graciously volunteered to be my partner for this assessment. Prior to coming into the room for his physical, he was asked to empty his bladder. We checked distance with the Snellen chart for visual acuity. We also tested nearsighted vision with the Rosenbaum chart. We checked his full set of vital signs, his height, and his weight. He weighs 250 pounds and he's 5'11". His blood pressure is 120/60 with a heart rate of 82, respirations 18, temperature 98.2, and he denies being in any pain. Are you ready to start, Carlos?
Yes, I am.
Okay. Okay, we will begin with an inspection of his face and head. His skin color looks pink, looks dry, normal for his ethnicity. His head appears to be normal cephalic without any masses or indentations. His eyebrows are equal and reach the outer canthus of the eye. His hair is full. It's neither too fine nor too coarse and doesn't come out easily when touched at the follicle. His eyelashes are extending outwards. His ears appear to be symmetrical, neither being too high or too low. His eyes are also symmetrical. His nose skin color matches the rest of his face. His lips are pink and appear to be moist. I'm going to go ahead and palpate his skull. Palpate his facial bones. Palpate the sinuses. And palpate the lacrimal gland. I'm palpating the bridge of his nose. Did you feel any pain?
No.
Okay. I'm going to go ahead and check your eyes, the sclera and the conjunctiva. I'm going to gently pull down on your eyelids. I want you to look up. Sclera is white and conjunctiva is pink without any discharge. Okay. There's no swelling underneath his eyes either. Can you follow my light? Now I'm going to shine some light in his eyes. Okay, again. Can you cover your right eye? And cover your left eye? There's no nystagmus. He has equal extraocular movements of the eyes. So cranial nerves 2 is intact. Cranial nerves 4, 3, and 6 are also intact. I'm going to go ahead and check the interior structures of the eye with the ophthalmoscope. Go ahead and look straight ahead. I'm observing the red light reflex and then going in for the structures of the eye. Doing the same on the other side. Okay, all optic disc was visualized and it was intact. There were no abnormalities seen with the ophthalmoscope either. I'm going to go ahead and move on to your ears, Carlos. I'm going to palpate the auricle. It's firm and mobile without being in any pain. I'm going to assess the outer canal and structure, looking for any foreign bodies or abnormalities, and there are none. You're going to feel me lightly pull on your ear. Minimal cerumen in hair. There's no redness or discharge. Tympanic membrane is intact, and I could observe the cone of light. And there was minimal cerumen and hair without any discharge or foreign bodies. I'm going to now check your hearing.
Apple. Banana.
We're going to move on to the Rhine exam. Let me know when you no longer hear it, placing it on your mastoid bone.
No.
Let me know when you don't hear the sound.
No. No.
Let me know if you hear things the same on both sides or one side less than the other. Equal?
Equal.
Okay. And that was the Weber exam. I'm going to go ahead and take a look at your nose. Nares appear oval without any abnormal discharge. Sniff. Sniff. Nares are patent. I'm going to look inside your nose. Nasal passage is clear and the septum is midline. Color is pink, matching the rest of his mucous membranes. The terminates do not appear to be swollen. Okay, and cover your eye, close your eyes and cover one side of your nose and tell me what you smell.
Coffee.
That's correct. Other side.
Peppermint.
Okay, cranial nerve 1 is intact. Okay, we're going to move on to the assessment of the oral pharynx. I'm going to look inside of Carlos's mouth. I'm inspecting his mouth and looking to ensure that the skin is intact, that there are no abnormal fissures or cracks in the skin, canker, sores, or any kind of abnormality. When I look inside of his oral pharynx, I'm looking at the hard and soft palate, his uvula, the tonsils, and the pillars. I'm ensuring that his tongue is pink and moist, that there's no coating, that all of his teeth are intact. The color should be white, there should be no missing teeth, and tongue movement should be strong. Okay, I'm going to have you open your mouth. I'm going to look at your buccal mucosa. Hard and soft palate look intact. Can you say, stick out your tongue and say, ah? Okay, uvula is midline with a normal rise and fall. Open your mouth and stick out your tongue. Gag reflex is intact. Now stick out your tongue and move it from side to side, up and down. Okay, a more thorough assessment would include sweetness and saltiness, but we're not going to do that for the purposes of this demonstration. So cranial nerves 9, 10, and 12 are intact. Okay, Carlos, we're going to move on to your neck. Can you look up for me? I'm inspecting his neck. I'm looking for symmetry. I'm ensuring that there are no abnormal pulsations or masses. Can you swallow? Okay. Look from side to side. Okay, now I'm going to check your range of motion. Move your neck up and down, side to side, and ear to shoulder. Great, now do it against my hand. Other side. Okay. Now I'm going to palpate. The trachea is midline. Go ahead and swallow. And his thyroid is smooth. I'm palpating the carotid pulse. Other side. Pulses are strong and irregular. I'm going to go ahead and palpate Carlos's lymph nodes, starting with the preocular, the postocular, tonsillar, submandibular, mental, superficial cervical, posterior cervical, deep cervical, supraclavicular, postclavicular, and axillary. Lymph nodes are non-palpable and they appear to be non-tender. Okay, Carlos, we've looked at your eyes. They appear to be symmetrical. Your eyelashes are extending outward. Your ears are symmetrical. Now we're going to do some exercises with your face. I want you to repeat, do what you see me do. Crinkle your eyebrows. Blow out your cheeks. Smile with your teeth. All right, great. Cranial nerve 7 is intact. Now push up against me. Great. Cranial nerve 11 is intact. Okay, Carlos, now we're going to move on and test your upper extremities. I'm going to palpate and ensure there's no tenderness, crepitus, inspecting the skin, hair distribution, looking at the color. Radial pulses are strong and intact. Brachial pulses are strong and intact. I'm going to take a look at Carlos's hands. His nail beds appear flat and smooth. Cap refill is brisk, less than 3 seconds. There's no clubbing of their fingernails. There's no cyanosis. Turn your palms over for me. And again, skin is intact. Okay, you can put your hands down. Since we're here, we're going to go ahead and check strength. I want you to bend. Push against me. Now pull. Great. Now with your wrist. Don't let me move them up or down. Okay, go like this. Push against me. Pull against me. Great. Arms out. Don't let me push you down or up. Okay, great. Now I'm going to have you, I'm going to inspect Carlos's back. Can you please turn around? I'm looking at Carlos's back. I'm looking at the cervical spine, the thoracic spine, and the lumbar region. I'm checking for symmetry and ensuring that his AP diameter is 2 to 1, which it is. I'm looking at his depth of breathing. And now we're going to palpate for any crepitus or tenderness or pain, ensuring that the thoracic cage is intact and stable. We're going to check for thoracic expansion. Carlos, you're going to feel me pinch your skin, bringing your thumbs together. Now take a deep breath. And my thumbs move symmetrically. Now that I'm here, I'm going to check for diaphragmatic excursion. Okay, Carlos, take a deep breath in. And I am marking where I heard a change in sound from resonance to dullness. Again, take a deep breath in. And breathe regularly. Now I want you to exhale and hold it. Breathe regularly. And exhale and hold it. Okay, you can breathe regularly. Diaphragmatic excursion should be between 3 to 5 centimeters, and it is. Now, in following a systemic fashion, I'm going to percuss his lung sounds on both sides. And there was resonance throughout. I'm going to continue by checking tactile fremitus. Whenever you feel me touch you, please say 99.
99. 99. 99.
Okay, now I'm going to auscultate your lung sounds. Please take a deep breath whenever you feel my stethoscope move. Carlos's lung sounds are clear throughout. There are no adventitious lung sounds heard. Okay, go ahead and turn around for me. We're going to continue our inspection of the chest. Again, I'm looking at Carlos's skin. I'm ensuring that it matches the rest of his body. I'm looking at the rate and depth of his breathing. I'm looking at his costal angle, ensuring that the ribs are moving symmetrically as well. We're going to check tactile fremitus anteriorly. 99?
99. 99. 99. 99.
And as we did in the back, we're going to percuss the anterior portion of the chest in an anterior fashion. Charma. Jordan. And resonance was heard throughout. We're going to listen to anterior lung sounds. Deep breaths. Lung sounds are clear throughout. Now we're going to go on to the cardiac portion of our assessment. Again, I'm going to begin with inspection. I'm looking this time at the left sternal border point of maximal impulse on Carlos. I'm assessing for any heaves or lifts, any abnormal pulsations, and I don't see any. I'm going to palpate the borders of the heart, the apex, pulmonic, and mitral. Again, I do not feel any heaves, lifts, or thrills. I'm going to listen to heart tones. Beginning with the aortic valve, the pulmonic valve, Erb's point, tricuspid, and mitral. Now with the bell of my stethoscope, can you please lean forward? And I'm assessing for any murmurs. And I don't hear any. Go ahead and sit back. Okay, Carlos, can you lay on your left side, please? I'm going to go ahead and listen to heart tones while he's in the left lateral position. Again, using the bell of my stethoscope to assess for any murmurs in the mitral valve area and the point of maximal impulse, and I don't hear any murmurs. We're going to move on to our abdominal assessment. Carlos, can you please lay on your back and expose your abdomen? In inspecting the abdomen, I'm checking for symmetry, any abnormal venous patterns, pulsations, or masses. I'm ensuring that the umbilicus is midline and his is inverted. Can you tuck your chin into your chest and lift? And no hernias are seen. Go ahead and lay back. I'm going to pull the camera closer so that you can see my assessment of the abdomen. We're going to begin with light palpation of the abdomen. We're going to begin with auscultation of the abdomen. You never want to palpate because then you might alter the bowel tones. Carlos has normal active bowel tones in all four quadrants. I'm going to continue to auscultate, but this time I'm listening to the arteries for any bruits. I'm going to be listening over the aortic, renal, iliac, and femoral arteries. No bruits were heard. Now we're going to go ahead and continue to light palpation. We're going to percuss all four quadrants. Tympany is heard. We're going to percuss for the borders of the underlying organs. Over the left side, we're going to percuss for the spleen, starting in the midclavicular line and working my way down about to the 10th rib, and noting where the sound changes from tympany to a dole sound. Doing the same in the right upper quadrant. We are going to percuss for the liver borders, beginning on the superior portion, working my way down, marking where the sound is changed from tympany to dole, and again from the umbilical side, following this midclavicular line, marking where my sound has changed from tympany to dullness, and he is measuring 6 centimeters. Now with light palpation of all four quadrants, And I'm looking at Carlos, assessing for any facial grimacing, seeing if he is in any pain. Are you feeling any pain?
No.
Now we're going to move on to a deep palpation. I'm going to reach underneath you and have you take a deep breath in. And I can palpate the border of the liver. Okay. While I'm here, I'm going to palpate your right kidney. Go ahead, take a deep breath in. Do you feel any pain?
No.
Okay, now we're going to go ahead to the left side. Again, I'm going to reach underneath, have you take a deep breath in. And I do not feel the splenic border. Okay, now bleeding for the left kidney. Let me know if you feel any pain. Deep breath in. Any pain?
No.
Okay. Now I'm going to palpate for the aorta. I don't feel any abnormal pulsations. And I'm palpating around the umbilical ring, looking for any firmness, of which I don't feel any. Okay, Carlos. I'm going to move on to the assessment of the lower extremities. Carlos is wearing pants today. Usually your patient would be undressed from the waist down. I would also check the circumflex reflex on Carlos if he wouldn't have pants on. And I would do that by lightly stroking the inner thigh, looking to see that the testicles rise up when I do that. Of course, for privacy and this demonstrative purpose, we're not going to have Carlos remove his pants. Now I'm going to assess the lower extremities. I'm going to palpate both extremities. I'm looking for any pain, abnormal crepitus. I'm assessing his skin for color and making sure that it's intact. I'm also looking for hair distribution. In a male, you should have hair and no areas of sparseness. I'm going to feel his pedal pulses, his dorsalis pedis, and behind his knee, I'm reaching for the popliteal pulse. And all pulses are strong. I'm checking the nail beds, making sure that they're smooth and symmetrical. There are no abnormalities. There's no thickness, yellowing of the nails. They are soft and smooth. Cap refill is brisk at less than 3 seconds. And I'm going to check strength. Can you push down and pull up? Okay, now lift your leg and don't let me push it down. Again with this leg, don't let me push it down. Okay, don't let me push it up. Other leg, don't let me push it up. Okay, Carlos is nice and strong. I'm going to have you swing over to the other side. Throughout this exam, we've checked several cranial nerves. Now we're going to test for a sensation. Carlos, close your eyes and tell me if this is sharp or dull.
Soft. 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 Sharp. Sharp. Sharp.
And his sensation is intact. We're going to go ahead and finish with our musculoskeletal checking his strength in his lower extremities. Can you straighten your leg? Don't let me push it down. Again here. Don't let me push it down. Okay. All right. And moving on to reflexes, we're going to check reflexes on the left side, and then we're going to check reflexes on the right side, going from the brachial reflex to the tricep, and then the brachial radial. Okay, Carlos, bend your arm for me. 45 degrees. That's a +2 reflex. Relax. Relax like a scarecrow. 1 to 2 inches over the elbow. Okay, +2 reflex. Slight pronation and holding his wrist. Okay. We will now check patellar reflexes and the Achilles. We'll check for clonus. I will now have Carlos stand, and we're going to check for a range of motion of the spine. His spine appears to be intact. I'm palpating the cervical spine, thoracic, and lumbar. There are no abnormal bumps or areas of tenderness. Can you bend down at your hips and touch your toes? His spine appears to be nice and straight. There's not any abnormal curvature that would signify scoliosis. Go ahead and stand. That concludes our assessment. Thank you.